Good morning. So I'm loud naturally, so it's very weird to have on a lavalier and having to talk into it, but we're doing it because I'm being videotaped today. So tell me if I'm getting too loud, okay? I'm Pam Gilliam. I'm the director of the Center for Health Services and Policy Research, which is one of the 20 gazillion research centers at the University of South Carolina in the School of Public Health. And my background is in evaluation and quality improvement. And about 6 or 7 years ago, I was working with one of our state agencies. I do a lot of work with our state agencies, and was doing some reviews for them, which was more of a quality assurance function. But what I realized is we were collecting such a lot of great data that we could present to them in a different way that they could use more in a quality improvement fashion. And then I had the opportunities to get training in some quality improvement methodologies that I'm going to talk to you about today and introduce you to. One coming out of the manufacturing industry, Lean Six Sigma, and I'll talk a little bit more about that. And then another one coming out of the Institute for Healthcare Improvement called the Model for Improvement, which is the one I think y'all are going to be the most interested in, and I'm going to spend the most time talking about that today. I believe that we all do PDSAs, or we do quality improvement in our heads all the time. I think we are constantly trying to figure out how do we make our lives more efficient, how can we make the way we use our time more effective, and we are constantly thinking about that. I use quality improvement to keep my house clean, okay? And so I have certain methods that I use to keep my house clean, and it helps me keep my sanity, and so I don't want to hurt anyone in my home, right? So we're going to talk about quality improvement and talk about how you can use PDSAs, which are Plan, Do, Study, Act cycles, in the work that you do, because we can't do PDSAs in our heads in the work that we do. In terms of, I'm assuming all of you are here because you want to improve the lives of the children in South Carolina, right? And so that's not an easy thing to do, and really requires working in teams. And so we'll talk about that today a little bit, but I hope that you leave this session, and we're going to do an activity at the end. I hope you have the opportunity to take a tool with you and get to go back and use it at home, or the office, or both. So the focus of our session today is to talk about 3 things. First of all, we're going to talk about quality improvement. What is it? What does that mean? And we're going to talk about quality improvement and the difference between quality assurance, because I hear a lot of people say, oh, we're doing quality improvement, when really, in fact, they're doing quality assurance activities. And then I'm going to introduce you to 3 different quality improvement tools: Lean, Six Sigma, and the Model for Improvement, and terminology that you'll hear associated with those 3 quality improvement methods. But then at the end, we're going to focus specifically on the Model for Improvement, because I think in the work that you do, that's the most relevant one, and it's easy, and you can go back and take it home with you. So here's why I think you should care about quality improvement, okay? You may not fit in all 3 of these categories, or even one of these, but I think you might fit in the health educator category. In terms of the work that we do these days, you hear the term evidence-based practices. You hear that all the time. That's the what, right? If you're familiar with tobacco cessation, there's an evidence-based practice we call it in South Carolina, the 2 A's plus R's, ask, advise, refer. That's the what. But then the question is, well, how do you do it? If you work in a home visiting program, how does that translate into the work that you do? When do you do it with your clients or your families? Who do you do it with? When's the best time to offer it to them? Those kinds of questions come into play. And so we're told we need to be practicing evidence-based practices, but they don't tell us the how part. That's what we have to figure out. And that's where quality improvement really comes into play, having some skills in quality improvement. If you're a researcher, I'm a researcher, It's really about, you're seeing it in grants these days. They talk about evaluation, and they're not talking about just writing up a report at the end saying, did it work or not? You know, was it worth doing? What they really want to, what you're seeing now is more of this whole idea of how do you collect information in real time and use that information to change the work that you do so it's more effective. You're not just waiting till the end. And you're seeing that happen in practice-based research too, research in the community. And then lastly, if you're an administrator, even if it's not in a hospital setting, in hospitals you have quality departments and you're seeing it being required for reimbursement. And I think we're going to see more of that as time goes on outside of just the hospital or clinical settings. You're going to see more of that. So what do we mean when we talk about quality? The American Society for Quality is kind of the trade association for trained quality improvement experts. And you may hear me use the word process improvement. I might use them interchangeably, okay, just to give you the heads up. So if you hear me change the words, because they're pretty much the same. So they talk about, their definition for quality is the characteristics of a product or service that bear on its ability to satisfy stated or implied needs, okay? We offer products or services. That sounds weird, doesn't it? But you do. The care that you provide children is a service that you're providing. And evidence-based models are a service that you're providing, okay? And so that's how, when we think about quality improvement, it's you're providing those services to fulfill a need, okay? And quality is about providing a service that's free of deficiencies, meaning it meets those needs. So there are a couple of other definitions you hear from kind of QI gurus from the past, like Philip Crosby or Joseph Duran, in terms of conformance to requirements, which kind of sounds, that's not warm and fuzzy at all, or more of quality assurance focus. But in quality improvement, you're thinking about how do we provide our service the best way possible, okay? Now, Edwards Deming is kind of the godfather of quality improvement, and he calls it a never-ending cycle of continuous improvement. And that's the thing to me about quality improvement that's really important to understand, is that it's ongoing. You don't make a change and then say, okay, we made a change, that's great, we're done. You know, oh, we did a PDSA cycle yesterday. You know, it went pretty well. We don't need to do any more. We're good. Quality improvement is very different. It's about constantly looking at what you're doing and then deciding what are you doing next. Okay? That's why the word cycle is in there. That's why the word is in PDSA cycle, right? You do it again, and you do it again. So just a little bit of history in terms of the quality journey. So in terms of it really started with quality assurance, being how do we really conform to minimum standards, and we'll talk about quality assurance more in just a minute. And then moved into more of quality improvement is how do we study our system, how do we collect data so we can understand our system better and understand what changes we need to make for improvement purposes. And then now it's about this whole idea of rapid cycle quality improvement. It's how do we collect information, you know, in real time, meaning that day, that hour, and how do we use that information to be able to make changes or just to make sure that we're on the right path. Things are going well. So you also hear a lot, this is a bunch of different kinds of quality improvement methods that you hear about. So the model for improvement we'll go over. You hear about business process re-engineering, That's going on with our Department of Health and Human Services and our Department of Social Services. SNAP and TANF eligibility and Medicaid eligibility are right now going through business process re-engineering, where they're trying to change their business model so they can do a better job in their eligibility determinations. You hear about DMAIC, define, measure, analyze, improve, control. That's the methodology in Six Sigma. It's focused on quality. You hear about lean. Lean's about efficiency. How do we speed up the process and not lose quality? And then the Plan, Do, Check Act, which is another term for Plan, Do, Study Act, that's a part of the model for improvement. So when I think about quality improvement, it's about measuring where you are. You got to have your baseline to be able to tell whether or not you've made an improvement and figure out how to make things better. And you're always asking the questions, how can we do things better? It's very purposefully not about pointing fingers. And that to me makes quality improvement one of the big differences between that and quality assurance. Oftentimes quality assurance is about pointing fingers at the person or who made the mistake. Quality improvement is about, hey, we got errors. We know we've got errors. You know, what kind of errors are they? You know, is it everybody across the state making the errors, or is it just in a specific region? Those kinds of questions you're asking. And it's about creating systems to prevent errors from happening. So we call it dummy proofing, mistake proofing. How do you ensure, you know, when you go online and you're filling out you bought a plane ticket online and you have to fill in the fields, you know, your first name, your last name, your phone number, address. Well, you know that big red box that pops up that's an alert, says, well, you didn't complete this field? That's dummy proofing. That's mistake proofing. So the three models for improvement that I wanted just to mention to you today and just tell you a little bit about is Lean, Six Sigma, and then the model for improvement. And Six Sigma is really focused on reducing variation. How can we make sure that when we do provide a service or a product, it's the same thing every single time, okay? So that's what the focus is. And you see the word DMAIC, define, measure, analyze, improve, control, CPK, it's process capability. Those are the terms that you'll hear if someone's talking about Six Sigma. So when you think about Six Sigma, it's about reducing variation, quality, okay? Lean is focused on efficiency. It's about the process, how long the process takes, how fast can you speed up the process, but not to the point where you're losing where you're messing up your variation. So what you're seeing are trainings in Lean Six Sigma, so you're getting both because they like to use both tools together. You're trying to speed up your process, but you don't want to lose, you want to keep your variation very small. You want to make sure your product or your service is still the same every time. And so terms that you'll hear with Lean are like process mapping. It's focused on eliminating waste. You'll hear the term tack time, WIP, work in progress. But it's, when you think about Lean, you think about speed. That's how I think about it, speed versus variation. And then the one I really like the most that I've been trained in formally is the model for improvement. This is the one that I really think is most useful in terms of the work that we do on a day-to-day basis. And it's really about improving on a very small scale, okay? I've worked with a lot of state agencies. I've done a lot of work in clinics. I've done a lot of work in our eligibility offices for a number of our assistance programs in our state. And what I've seen is where an improvement is, or a change is made, but it's not really an improvement, and they keep doing it anyway because they put so much work into it. The whole idea behind the model for improvement is you start so small, even if it's just with one person, testing something with one person to look to see what kind of impact it makes. It's this idea of how can you test an idea that you have, a hunch, a theory, and test it on such a small scale that doesn't use up a lot of your resources. And then you keep building upon that. And so the term you'll hear mostly associated with the model for improvement is the PDSA, and we're going to do PDSAs in a little bit. This is also really helpful. The model for improvement is when you know there's an evidence-based practice out there that is shown to work, okay, like the 2 A's plus R, and then you want to test to see how it would work in your environment, okay? And the model for improvement is really big on how can you take evidence-based practices that may come out of completely different fields than yours and test them in your environment. So let me give you a couple of examples. In the airline industry, they use, before a pilot takes off, they have a checklist. And they go through that checklist and make sure everything's been checked off before they take off. And they have reduced a lot of errors, saved many lives because they have that checklist. Well, in the healthcare setting, they're doing the same thing. You're seeing in surgical settings, you're seeing before patients are discharged from hospitals, this whole idea of a checklist. You need to go through the checklist and make sure everything's checked off before letting the patient go. Or before you start surgery. Did this happen, this happened, this happened, this happened. And it's significantly reduced errors and improved patient outcomes because of that. So that's the whole idea, okay? Airline to healthcare. Now let me tell you, I'm about to let you in on the secrets of keeping your house clean. Because this is what I learned, evidence-based practice, and then I use it in my home. So when I worked in food and beverage many, many years ago to get through college, I waited tables and we had a new manager, and she was, had gone to school for food and beverage, in hospitality and retail management. She had a degree in it. She had managed quite a bit. Well, her big rule for servers was you were not allowed to walk from one area of the restaurant to the other without something in your hand, okay? That was her big rule. If you were at the hostess station and there were, the hostess oftentimes rolled up the utensils and the napkins, you would pick them up and you'd walk through the dining area and place them where rolled up utensils were missing. If before you even left that dining room, you would look for dirty dishes. Pick them up, take them to the dishwasher. Drop them off at the dishwasher. Are there clean dishes? Pick up the clean dishes, go put them up. So you're just constantly walking around, and she would stop you. If she saw you walking with nothing in your hand, she would make you go back to wherever you came from. Well, I do that in my house. I never leave a room without something in my hand to take to another room. So we walk into the kitchen, that's how we get into our house. There's a door into our kitchen. That's the dumping ground. It's my kids' dumping ground. I have a basket by the door for shoes, but for whatever reason, they don't end up in there. But that's where a lot of stuff ends up being, right? So often, whenever I leave that kitchen space, I never walk without something in my hand to another space. And then oftentimes I walk through my living room to get to our bedroom, or walk through the house to the kids' rooms. And when I'm in a space, I look for what needs to be taken out of that space and put in another area. And so it keeps my house straight. So I really recommend you go home and try walking around your house with something in your hands all the time. But it has worked. But it's the same idea about, I took something from the food and beverage industry and I do it in keeping it in the house cleaning industry, right? Do you understand the concept? Yes? Okay, good. PDSA stands for Plan, Do, Study, Act. You'll also hear PDCA, which is Plan, Do, Check, Act, and we're about to get into that. The things that you need to know, though, across all three of these models, regardless if you use lean, quality improvement, or or Lean, excuse me, Six Sigma, or the Model for Improvement, they do have things in common, okay? One of them is, it's understanding how your process flows. Edwards Deming says if you don't know your process, then you don't know what you're doing. One of the first things I do with any group that I work with who's struggling with a problem is I help them map out their process. And we've done this, I've used how do you cook macaroni and cheese? And you write out the steps. What's the first step? It could be different for everyone. Some people, the first step is go to the grocery store, buy a box of macaroni and cheese. For others, it's go through the drive-thru at Kentucky Fried Chicken and pick up macaroni and cheese. I mean, everybody's got to be on the same page about what the process is. And so process mapping is really great. You've got to understand how your process flows. You also have to have, in any quality improvement methodology, you need to have a goal. You have to have an objective, an overarching reason why you're wanting to make a change, okay? And you need to understand that so you can understand what your test that you're trying to, or whatever change you're trying to test needs to be linked to that. Leadership and organizational buy-in. It doesn't matter if you're using Lean, Six Sigma, or the Model for Improvement. You have to have leadership commitment who's willing to allow you to use quality improvement methodologies and tools and allow you to test changes. The voice of the customer is really, really important. Internal and external. So oftentimes we think just of our customers being the families that we serve. That's not always the case. And we'll just talk about that again in a second. And quality improvement always is about collecting some kind of data. Money is getting tight, right? When you apply for grants, they're more competitive. It's harder sometimes to get money to support the programs that we do. Data and measures are really, really important in terms of helping this. The warm and fuzzy stories can't be it alone. You've got to have both. And so collecting some data and measures to know that you're making an improvement is really, really important. And use of teams. That's another thing across the three. You do not see quality improvement happen by a single individual. And especially in the work that we do, because we're trying to address really tough issues with our families, there's no one right answer. And so you've got to work in teams. And quality improvement that's key for quality improvement. So different tools, you'll hear these words: control charts, Gantt charts, root cause analysis, plan, do, study, act, flow charts. Those are all terms you'll hear and if people are using those tools, they're probably talking about quality improvement. As I mentioned to you before, quality improvement is always about the customer. It is always about the customer. And sometimes that might mean we can't serve that customer. So when you think about who your customer, and it might be you have more than one customer, thinking about what you're doing and the changes that you want to test, how does that improve the services or the products to your customer? Quality improvement, as I mentioned, is about leadership commitment, but it's also about having buy-in and support. So it's from the people who provide the services on a daily basis. So it's not just top down, it's bottoms up as well. I mean, how many times do you get a new policy that tells you what you have to do, but you didn't have any input on it? We joke and say, it comes from the ivory tower, comes down, they've never worked or in direct service, or it's been years, right? Quality improvement is about engaging staff at all levels to test changes. All right, differences between QA and QI, quality assurance and quality improvement. So I'm just going to go over a few. I've got a couple slides, and then I'm going to give you a quiz, okay? And to get your parking pass to get out today, you have to pass the quiz. Just kidding. All right, so quality assurance is really about conforming to minimum standards. Did you meet the minimum standard, okay? Quality assurance is about inspection. It typically, and you'll have like a department, like the auditors that come in. It's retrospective, they come back, they audit charts. Their division that's separate from everyone else, typically. In quality improvement, it's really about how do we improve the performance. It's not about making sure we just meet the minimum standard. It's constantly looking at how do we improve to do better. It's focused at the systems level. It's not looking at specific people and the work that they do. Yes, you may go look at charts, but it's not to say so-and-so didn't do this correctly. It's more of to say, okay, what types of errors are we having? What kind of training, which might lead into what kind of training do we need? You know, in Medicaid eligibility, so those are the reviews that we do for the Department of Health and Human Services. And so the way we use the data from the eligibility determination reviews, we use both QA and QI. So we review their charts for them, but then we are able to feed back to them to say, you know what? This error is happening across the entire state. It's probably not a training issue because everybody's making it and you've done training over and over again. You might need to look at your policy. You might need to think about changing your policy so that, or rewrite your procedures so that your workers can better apply the policy that you really want them to do. They tell me a lot, they're like, well, the intent of the policy. Well, there's a big difference between intent and actual putting it into play. Quality improvement is everyone's involved, it's interdisciplinary, it's not this separate department, okay? QI, when you have a culture of QI, everyone has some level of training in quality improvement, everyone participates in testing changes. It's not just about a one-time deal in terms of quality assurance, quality review. I've gone over these, mentioning them again. Quality assurance is typically time limited, like an audit, chart audit. Quality improvement is continuous. And it's focused, as I said, on performance. It's about best practices. How do we ensure we're doing best practices? All right, y'all ready for your quiz? So you have to talk. I've been talking a lot. Now it's your turn. All right. I've got some statements. I want you to tell me whether it's quality improvement, you can say QI, or quality assurance, QA. So which staff member failed to transfer the call to the correct extension? QA, that's right. Are we creating an environment encouraging clinicians to report errors? QI, exactly. You know we have this problem that clinicians are not reporting errors. Are we going to solve the problem by going to talk to so-and-so and tell them to stop doing that and to report the errors? Probably not. So how do we figure out why they don't report errors? How do we reduce billing errors by our staff? QI or QA? QI, okay? We know we have this problem. What kind of billing errors are they making? Is there a way to dummy-proof the process? Can we figure out which step in the process where the errors are occurring? Those are the kinds of questions that you ask in QI. Patient had a bad outcome. Were the doctors or nurses at fault? QA. Who can I blame? Okay? Last one, what could we do to increase the efficiency of chart filing? QI. If you see the word efficiency, you can pretty much bet it's QI. Good, you guys passed. You won't have to pay for your parking today. All right, so let's talk about the model for improvement. This is the tool I want you to be able to leave today and go home and try out, okay? So the model for improvement has 3 basic questions, and you have to ask these questions first. You don't do the PDSAs without these 3 questions answered first, okay? The first question you're going to ask is, what are we trying to accomplish? What is it that you're trying to do? What's your goal? They call them aim statements. What's your aim? Aims oftentimes look like objectives, okay? They're smart. They give you a time period in which you're trying to do something, and they have some kind of measure in them. We want to reduce the number of our mothers who smoke during pregnancy by 25%, okay? If you know that you have 50 mothers, you should be able to calculate how many of them that you're trying to focus by the end of, say within the year, whoever's pregnant, okay? Or depression screenings. I know a number of home visiting programs will require a depression screening. What we found is even though they require it, not everyone was doing it. So what's the process for ensuring that they're doing them? We want to make sure that 100% of our mothers get a depression screening. And then you might even say, we want to make sure they have a depression screening done every 6 weeks or 3 months or certain time periods. But you got to know what your goal is, okay? The next question you ask is, well, how do we know that a change is an improvement? And those are your measures, okay? That's your data. Sometimes it's quantitative data. Sometimes it's qualitative data, meaning you're talking to your customers to say, hey, is this getting better for you? Are you happier? Has this worked? We've been providing you a reading calendar because we want you to increase the amount of hours that you're reading with your child, because we know that interaction improves the relationship between the parent and the child and can reduce parent stress, right? I could go on and on forever. So you've got to have your measures. You need a baseline, so you know where you are today, and then you need to collect data throughout. Now, I'm not talking about statistics, I'm not talking about regression analysis, I'm not talking about confidence intervals, I'm not talking about p-values. I'm talking about averages. Do you know how to calculate an average? Range, think about range, your median, just your basic, your mode, your basic descriptive statistics. That's where the focus needs to be. Yeah, it's a lot, yeah. And then changes. Well, what changes are we going to make? Okay, that's when you think about your evidence-based practices. It's also when you think about the how. So, for example, the 2 A's plus R put out clinical practice guidelines. It pretty much, the article tells you what you need to be doing to reduce tobacco use, okay, amongst families. Not only is it just the 2 A's plus R, but it's about providing materials to families, having a quit line, the fax line, if you're familiar with that in South Carolina, so they can get free counseling sessions. Those are the kinds of things that we talk about. How do we test that with our clients? And see if it makes a difference in reducing their tobacco use. So you have to answer those 3 questions first, okay? And then you start testing changes. And you test changes using the PDSA cycle. Plan, do, study, act. I've talked about these. I'm kind of jumping ahead. So I went over these. Aim statement. Your senior leader needs to be committed to whatever your goal is, okay? So that they'll allow you to test changes. You need them to be supportive, because what if you want to test something that might go against a certain practice or policy that would be really hard to change? I mean, you need to, that's why it's so important to have their support. And you need to steal from others. If you know other people are doing great things and it's working, you need to try it. You don't need to come up with something so crazy, fantastic, new. Go steal somebody else's idea. That's okay. Measures. I talked a little bit about it. There are 3 basic measures, types of measures. There's outcomes, process, and balancing measures. So I'm working with free clinics in South Carolina right now, and we're talking about measures. And DHHS is giving them a little bit of money, and the outcome measure that they've given them is to improve health outcomes among chronically ill, okay? So that's a great long-term outcome, but then you need to think about what are the process measures that are going to help you get there. Like, is it increasing the number of staff? So then you can open your clinic doors longer. Is it, you know, being able to provide certain type of specialty care, like dental care, in your clinic? Because you have a lot of patients, you know, that come in that have that, and oftentimes that takes them to the ER because they're uninsured, they can't afford to go to a dentist. And then balancing measures. So what we mean by balancing measures is, if you make a change, how does it affect the rest of your program? If you move 3 of your staff from one area to the next, because that's where you're trying to make some improvement, how did that affect the area where you moved them from? So those are things you have to pay attention to as well. One of the big, when I worked with DHEC, so I'm going to pick on DHEC for a minute. Any DHEC employees here? Okay, good. One? Okay. You can tell them I talked trash about them today. So DHEC, a few years ago, I worked with them they wanted to implement a policy on using the evidence-based practice 2As plus R. I know a lot about this. I've lived and breathed it for a while. What was funny was their division of tobacco worked with external providers to train them in the 2As plus R, but their own clinics within the agency weren't using them. And they were like, well, duh, you know, we should require our clinics to use them. That's a great idea. But they got a lot of pushback from the regional leadership. And the big issue was it's going to take too much time. They're already busy. The nurses working in the clinics, because we started working with family planning clinics primarily and WIC clinics, women, infant, and children. And they said it's going to take too much time. We don't have time to do this. Well, we tested using the model for improvement in like 3 family planning clinics and 4 WIC clinics to see if it really made a difference. Well, what we found, we had them collect data. One of them was, how many people come in on a day-to-day basis who actually smoke? Okay, of your 40 patients, how many come in? Well, they found on average it was about 20 to 25%, okay? So out of 40 people that come in, that's like 8, maybe less than that, 7, 6, that's come in a day. Okay, so you've already knocked down your number to 6. They've identified themselves as tobacco users. You ask them, do you smoke? I smoke. Smoking is bad for you. I've advised them. And then R is the referral. Would you be interested in receiving some free counseling sessions from the 1-800-QUIT line? Well, then you have to ask the question, well, how many of them accept the referral, right? So then it bumps your number down lower, right? So then how long does it actually take? Say 2 of them, of the 6 people that showed up that day, accepted the referral. How long did it take to do the referral? Well, we had them tested. On average, it took 3 to 5 minutes to complete the paperwork. Not a lot of time. And so overall, what they found, we were able to give them data to say, This isn't going to take up a lot of your time. It's not going to increase the workload of your nurses. You're going to be good to go. And they were willing to accept that. And so they came out with a policy, but they let us test it first. They let us test these changes. It was so cool. It was a really neat process before they went and put the policy in place. So that's just an example of how QI can work. All right, y'all ready to play? Well, let's talk just real quickly. Plan, do, study, act. Okay? Plan is, what do we ask the question, we've got this problem, why don't we try something different? You know, what'll happen if we do this? So you have your objective, you have your questions that you're trying to answer, you have your predictions on what's going to happen. Have you ever planned a party before? Okay, that's what happens in the plan phase. You're planning that party, the who, what, when, where, okay? I worked with a clinic in the upstate who wanted to, one of the problems they were having was the wait time for their patients was too long. And part of the reason is because their certified nurse assistant's office was way around the corner, and she never knew when charts were being placed in the mail slot for her to go pick up, to go then get the patient. She would just have to walk back and forth. Well, they ended up moving her office. They just moved her office. And then they moved the mail slot to her office. So she knew when they came in. All they did was move her. So they tested a change and found, and it reduced wait time for the patients that came in. So that's what we're talking about when we're talking about planning. We're going to move her office on Tuesday. We're going to have the admin staff take her the charts straight to her office where the mail slot is and see how that works. And we're going to test the time. You don't do PDSAs all the time unless you want to try to test, unless you're wanting to make a change, okay? PDSAs are for testing changes. PDSAs are for adapting a change. And PDSAs are for implementing, okay? And also for spreading. So we tested it in our family planning clinic. Now we want to go try it in our immunization, in our WIC. That's what we mean when we talk about spread. Or maybe we just do it with one type of patient or client that we serve. Now we want to try it with other clients that we serve. To be considered a real test, okay, these are the things that you have to do. You have to plan it. Plan your party, okay? Plan your path, plan your test. You need to carry it out and collect data. Okay, that's the do. We're really good at doing the do. We're good at doing the plan, we're good at doing the do. What we're not so great at is the study and the act part of the PDSAs. We don't make the time to get back together to talk about those. You need to set aside time to analyze the data, okay? And then you take action based on what you learned. That is a PDSA cycle. You plan it, you do it, you study it, you say, did it work, did it not work? Well, maybe if we tweak it just a little bit, let's try it again. Or it worked great, now let's do it with 5 patients. We did it with 1 patient yesterday, let's try it with 5 patients tomorrow. And you document it. You are not doing quality improvement. This is my big lecture. You are not doing quality improvement if you don't document, okay? So you need to write down each phase. What happened in plan, you know, answer those questions. What happened in do? What did you find out in study? And then what are you doing next? And then as I mentioned to you before, there's a reason why the word cycle is in there. It's because you do it over and over and over again. All right, let's practice. So I'm going to have you break up in teams. I'm going to have you 3 work together. And you've got the sheet right here with the green gems. I'm gonna have, would you mind coming over here, Susan? And I'll have you turn around and work with them, Brenda. And then I'm gonna have you two join these three. No, I lied. You guys group together. I'll have you turn around and work with these gentlemen. All right, have you ever been to Po Folks or Cracker Barrel? Okay. Done the pegboard? All right. If you've never done that before, have you played checkers? All right. Why don't you two join them? So then we'll make the teams a little bit more even. Sorry, Veronica. So turn the sheet over. Has anybody ever done this before? And then you get frustrated. Oh, good. All right. So we're going to go through one round, okay? Your goal is to get just one gem left on the page. So you cover up, you take the gems. Has anyone at this team played this before? Okay, good. So you cover them all up but one. And your goal is to get just one green gem left on the sheet. And it's just like checkers, you jump. Okay, do you guys know how to play? Your goal is to leave one, and so you can jump going diagonals kind of where the line. It is, it's just like checkers. So just go through one round and see how many you have left. Do you guys know how to play? Okay, cool. Is this your first time? Yep.
Yeah. Oh, okay.
Got it? Oh, can't move. You jump. You're playing chess. All right, 4. We've got 4 here. Just do it once. How many times did you get your first round? 5? Okay. Three, okay. All right, so we have 5, 4, and 3 so far. Hold off, hold off. I know it's fun. How many guys did you guys get the first round? Do you remember? About 3? Okay. So let me ask you guys a question. I know you're having fun, but let me ask a question first. So, what was your strategies to get 3? What was your strategy?
Working together.
Okay. Would you be able to replicate the same process you just did? No. All right, so have you guys done a PDSA cycle?
No.
No. Why have you not done a PDSA cycle? You didn't plan it, you didn't document it, you didn't study it, you just decided, you went straight to act. You're like, I'm going back and playing this game again. All right, I want you to take the time to plan, do, study, and act and see if your game improves. If someone has like a sheet of paper, you all seem to have some paper with you, think about the plan. Because remember, it's about improving your services. Can you reduce the variation? Can you do them over and over and over again the same way and get the same results? My gosh, I gotta drink some coffee. One team that got one. All right, Anna, would you be able to do it again? That's the question. Oh, they're saying no. Probably not. So you did not do a PDSA cycle. Your aim or your goal is to get down to 1, right? Your initial baseline measure was the first time you played it, how many you got. You're trying to improve from that. Oh, wow, that's cool. Okay, that's totally fine. The reason why you document is so that, here's another reason why you document, guys, is so you don't make the same mistake twice. It's okay to fail, right? Because you did a PDSA on a small scale. It didn't really affect your resources. Ah, did you document? So you think you could try it again? See if you can get it again. I still see some moves.
Oh, no, I just put them on.
Oh, I'm sorry. I was like, you can get down to 1. Good, so you improved. Did you get it?
We did.
And can you replicate it? We're going to see if they can replicate again, and then I'm going to have you guys say what you did, your numbers out loud, and the other groups can do it. So we had a group get down to 1 over here, but they didn't document. So they will not be able to provide the same services as well as they did the first time. I want to compare what you have to what I have. Did you do it? Two left. Okay, good. All right. I'm going to let the team in the back. Are you still not documenting? I mean, come on. All right, put the cover them back up. I'm going to have the team in the back. Ron, will you be the one who yells out the? All right. 5. Okay, we've got 5 minutes. All right, Ron, what's the first?
Leave the 6 open.
Leave the 6 open. Okay, how important is that to know? Very important. Okay, that's part of the planning. All right, go for it.
13 to 6.
13 to 6. I feel like we're at bingo.
11 to 13.
11 to 13.
2 to 9.
2 to 9.
14 to 12.
14 to 12.
12 to 5.
12 to 5.
7 to 2.
7 to 2.
1 to 4.
1 to 4.
3 to 8.
3 to 8. There you
4 to
go.
13. 10 to 3. 13 to 6. That was good. 3 to 10.
All right. Let's give them a round of applause. Very good. They did document that time. Finally. I'm a little worried about sending them off. So just to reiterate, when we do PDSA cycles, first of all, you have to answer when you're doing the model for improvement, you have to answer the first big 3 questions, okay? What's our goal? What are we trying to do here? Why? So what? Why are we trying to test a change? For what purpose, okay? And then, how are we going to know if we made an improvement? Our measures. Our measures are really important. You need to have a baseline. You need to know where you're starting. And you need to know where you need to collect data at the end to see if there was a difference. And then your changes. What are the changes that you're testing? Your changes can be evidence-based practices. They can be things that came from another industry that you want to test out in your setting. They can be just good ideas, okay? Those are the things we're talking about. Aim, measures, changes. And then the PDSA cycle, plan, do, study, act. Documented, written down so you know what worked and what didn't work. PDSAs are important for both, okay? It's okay to fail. That's why we do small scale testing. Because if we even try it with 1 patient on 1 day, how much resources did you really use, okay? Instead of doing a big, huge change, not sure if it's going to work, and it required a lot of your resources. So I hope you will go back, you will take the model for improvement with you, you will try it to help you reach one of your goals, and to try to test some great ideas that you have. And thanks, I hope you guys had a fun time. I appreciate it, it was fun. Thank you.